Hello, my name is Melinda Mara. I'm enrolled in the Psychiatric Mental Health Nurse Practitioner program at Eastern Kentucky University. I currently live in Arizona and have been a nurse for 15 years. Although I've worked in many areas of nursing, for the last 4 years I have been working at the Maricopa County Jails. Most of the inmates at booking are withdrawing from either alcohol, opiates such as Oxycontin or heroin, methamphetamines, benzodiazepines, spice, bath salts, or a combination of them. Within the last year, we have had to increase the use of naloxone, which is the drug that reverses the effects of opiates. We've also had to increase lorazepam to prevent inmates from having fatal seizures induced by alcohol withdrawal. Observing this daily at work has sparked the spirit of inquiry on substance abuse in America. The National Institute of Drug Abuse defines substance abuse as a chronic disease with symptoms entailing drug seeking, drug use that is compulsive, and use that is difficult to control despite harmful consequences. Consequences that include unemployment, homelessness, and health risks, including death. Currently, America is experiencing a substance abuse epidemic. To showcase the magnitude and importance, it has been reported that over 64,000 people died last year of overdoses alone. That is the equivalent of the United States experiencing a 9/11 terrorist attack every 3 weeks for 1 year. This astonishing number does not include the substance abuse related deaths, motor vehicle accidents, suicides, homicides, sepsis, and other health issues such as cirrhosis of the liver and heart failure. Beyond lives lost, America spends over $600 billion annually on health care costs for the complications due to substance abuse. This disease affects all ages, all ethnic groups, and across all economic statuses. One of the groups hardest hit by this epidemic is our veterans. No matter what area of healthcare the advanced nurse practitioner enters, a portion of that patient population will be abusing substances. Current treatment as usual includes 2 elements. First, detoxification. Second is entrance into group therapy. As evidenced by substance abuse substantially increasing annually, one can conclude that the current treatment as usual is not effective enough. The 2 studies reviewed both had a control group who received treatment as usual, and both studies had a study group who received treatment as usual and in addition were provided drug-free housing and vocational support. Study 1 used 218 homeless veterans for their study group and 115 in the control group. Results included that after 12 months, the subjects in the study group were less likely to use drugs or alcohol. The study utilized interviewing as the data collection process, so a limitation is that the subjects may have underrepresented their use. Study 2 had 80 subjects in both groups. All participants had a diagnosis of opioid dependence and had just completed a detoxification program. They were followed over a 6-month period. Subjects were given urine tests to determine abstinence. The results found that subjects from the study group were 10 times more likely to abstain from using drugs. One limitation is that the urine tests were scheduled instead of unannounced, giving subjects the ability to plan any drug use around set testing. Having the awareness of this epidemic as well as the positive outcomes of the study, it is important for the advanced nurse practitioner to carefully screen every patient for substance abuse. Once identified, it is the obligation of the provider to offer information and guidance about appropriate programs for their patients within their communities. Understanding all of the needs of each patient, providers can create holistic care plans that address all basic needs of every individual. How these interventions change nursing practice is that if patients stay off substances, they can focus on other healthcare goals: medication adherence, attending follow-up appointments, and participating in self-care activities such as nutrition, exercise, infection control, and appropriate sleep. Outpatient clinics are an excellent place to implement these interventions. Advanced nurse practitioners should continue to study programs that utilize non-pharmaceutical interventions with positive outcomes. They can guide their patients to resources within the community or offer evidence-based practice programs in their clinics. In closing, this integrative review found that using non-pharmaceutical interventions of drug-free housing and vocational support resulted in positive outcomes. Advanced nurse practitioners should use evidence-based study to apply non-pharmaceutical interventions for their patients diagnosed with a substance abuse condition. This will give their patients the best chances to be successful and to obtain all of their health care plan goals.